challenge with Alzheimer's is that they're still the people you love and love you. And that's the most amazing thing.
With more than 1,500 people over the age of 65 living with dementia in Tempe, Mayor Mark Mitchell is leading the effort to make Tempe the first dementia-friendly city in Arizona.
Today is our first big step, public step in our community that we're going to be taking on a very important project in our community and in Tempe. It's our state's first dementia-friendly city. Now, I will admit that, like many of you and so many other people in our community, I really did not understand how common dementia was in our community until my mother was diagnosed with Alzheimer's.
About 90 people joined the mayor and the Banner Alzheimer's Institute at a recent kickoff event to explore how Tempe can improve the lives of people with the disease and help their caregivers.
Dementia is this acquired loss of cognitive abilities. We tend to think of it as being loss of memory, but it's memory as well as other cognitive abilities. It may be language, problem-solving ability, visual, spatial ability. And dementia is kind of that global overall term, and Alzheimer's disease is the most common form of dementia. So 60 to 70% of all the different, of all dementia is Alzheimer's disease.
Now comes the assessment of Tempe's strengths and needs, and the focus to develop an action plan.
So today is about engagement and learning from our community what they see as priorities. So what we're going to learn today, we're going to come back and look at more. We're going to begin to engage other businesses and the healthcare community and the governmental kind of programs and faith communities to really begin to understand what they see are unique needs. And then from that craft a plan where we really start acting to inform our community residents to change the way we're serving people. If it needs to be changed, looking into environments need to be changed or accommodated. What are those differences? Just so that we're aware of the people that we serve and we do it in the best way possible.
More than 1/3 of the day's attendees had a loved one with dementia. About 7% of the event's participants identified themselves as having dementia.
So one of the desired outcomes in this, knowing that this is a problem not only here in the U.S. but worldwide, is that we have to make our communities more successful and our systems more successful to support people with dementia to live in our communities, because isn't this where we live? We live, we work, we play in communities, and even communities within communities, right? There's our neighborhoods, wherever that might be, including residential settings that become new neighborhoods for people living with the illness. And then there's our faith communities, there's our bank and our grocery stores. These businesses that we frequent all become our community. And within that, the goal is creating both system and community capability to improve the lived experience, the quality of life for people who are affected by dementia as well as their care partners.
Representatives from the business, faith, and medical communities, as well as government entities, identified challenges and shared ideas.
How are we going to break through the stigma that we're all human and we're all here in this together, and it doesn't have to be so scary, and we can talk about it and we can work together about this.
Dementia advocates in the healthcare setting, not just having the social workers or those who are just in the environment, but having the advocates, having a person stationed in a certain setting, such as a rehab setting or hospital setting, and having that person be the go-to person.
Looking at our congregation, do we have people that are isolating themselves, not coming to church?
We do believe that moving forward, one of the first things we should probably do is provide training to first responders. Oftentimes, those are the only people getting into the homes.
Every part of the community plays a role and can work together to take steps to create a dementia-friendly culture.
Part of becoming a dementia-friendly city will help provide those resources, at least access to those resources and where to go and how they can help their loved ones as well as to help the caregivers.
Join the effort. Contact Dementia Friendly Tempe. Call 480-350-8959 or go to dementiafriendlytempe.org.